Hello friends, the topic for today's discussion is recurrence after hernia surgery. This is the common fear that the patients have before hernia surgery is recurrence or the chance of hernia coming back. Patients commonly say that the friend or relative or maybe a neighbor underwent a surgery few years back and after 5-10 years the hernia came back. So what is the point of undergoing a surgery if the hernia comes back? Or what is the chance of recurrence after my surgery? The answer to this question is not very simple. It depends on multiple factors. And let us today discuss what is the chance or what are the factors which prevent recurrence after a hernia surgery. Before I discuss about recurrence, it is very important to understand what we do in a hernia surgery. Hernia is basically a defect or a gap in the muscle, and during the surgery we close or repair the gap and put a mesh to support or strengthen the repair. This mesh helps in a formation of a healthy scar which is laid down by the body tissues, and this prevents the hernia from recurring. So a healthy scar is very important for prevention of recurrence, and any factor which prevents the formation of a healthy scar results in recurrence of the hernia. So when we discuss about recurrence, broadly if we classify, there are two broad factors which can cause recurrence of a hernia. Number one, there are variety of patient factors which can cause recurrence, and number two, there are some surgical factors or procedural factors which can cause recurrence. First, let us discuss about the patient factors. The commonest patient factor is associated diabetes. Patients who have diabetes or patients who have poor sugar control has very poor tissue healing capabilities. Such poor tissue quality, especially if the sugar is uncontrolled, results in a weak scar. And a weak scar in patients with diabetes results in a more chance of a recurrence or slightly more chance of reoccurrence of the hernia that has been repaired. Factor number two is smoking. The body tissues that is laid down for repair, it is usually called collagen. We think of collagen like the cement that is used for building. The quality of collagen that is formed in smokers is a poor quality collagen. Therefore, if patients continue to smoke after the surgery, or commonly in case of smokers, the scar is not healthy and the scar is of poor quality or a weak scar. Therefore, it is commonly seen that smokers have a slightly higher incidence of recurrence after a hernia surgery. Third factor is obesity. Patients who are obese or patients who gain weight after surgery have poor muscle mass. Obesity also has increased amount of fat in the body, and therefore this stretching of the tissues after obesity or the patient gains weight results or may result in recurrence of the hernia. Besides that, there are some factors like chronic straining factors, for example, chronic cough, straining in urine, chronic constipation, or any other straining factor or strenuous activities immediately after surgery can result in recurrence of hernia. Next, let us discuss about the surgical factors. Surgical factors may be varied and many. For example, it can be the surgeon's expertise in the surgery. The second factor may be the type of surgery which is performed, whether it is laparoscopic or it is open. There is no such hard and fast rule is laparoscopy is better or open is better. Some surgeries are better done laparoscopically. Some surgeries for complex hernias may be done open. So the surgery should be tailored depending on the type of hernia. And the best result is when the proper surgery is done for the proper type of hernia. The third factor may be the mesh which is used. A surgery without a mesh has a more chance of recurrence. Surgery with a mesh has a less chance of recurrence. So basically there is no hard and fast rule about recurrence. It depends on multiple factors, which can be patient factors, which can be surgical factors. And when we discuss the chances of recurrence with a patient before surgery, we put the various collective factors which is individualized, and we give a rough estimate of the chances of recurrence in such patients. Thank you.